In this section of the end of life or comfort care module, we'll be discussing hospice care. Hospice care is a type of specialized medical care designed to provide comfort and support to individuals in the final stages of a terminal illness and/or their life. The primary goal of hospice care is really to enhance the quality of life for both not only the patient, but also their family. I highly suggest listening to the interview with Usha Kokate. She has been a nurse for over 40 years and has specialized in hospice care for the past 15. It's quite fascinating listening to someone with so much experience. For this module, we're going to talk about some key elements and aspects of hospice care. Eligibility. When we're talking about the eligibility of hospice care, we're generally talking about how it is going to be paid. Hospice care is going to be paid 100% by Medicare or Medicaid for up to 6 months. But in order to qualify for hospice care, patients must be diagnosed with a terminal illness and are expected to have a diagnosis of 6 months or less to live, as determined by a physician. Patients also must typically agree to forego curative treatments in favor of comfort care for that terminal diagnosis. In the interview with Usha Kokate, she explains that if a patient lives past 6 months, they may still be able to qualify for hospice care. This is called recertification. This is where a doctor comes in, assesses the patient, and sees where they are at in their decline. The patient and the hospice company must meet certain guidelines in order for Medicare and Medicaid to continue paying for those services. Services provided. Hospice care can be provided in various settings, such as a patient's home, assisted living community, independent living community, a nursing home, or even a short stay at a hospital. It's really wherever that patient is located. There are many services surrounding hospice care. A main service is pain and symptom management. The hospice care company can help control discomfort with nausea, wound management, and other symptoms to ensure that patient is comfortable as possible. Each hospice care company will have its own specific care team. The care team may have a chaplain, a social worker, OT or PT, and of course, nurses. Each specific person on the care team has their own duties. A solid hospice team would meet regularly to discuss each individual patient and how to proceed to give the best care possible. When researching a hospice care company, find out who is on the care team. Find out how often they meet. These are all questions that you may want to ask. Just because you have chosen a hospice care company or one was assigned to you doesn't mean you have to stay with them. It is the free will and choice of that individual patient to switch with no ramifications. Costs and coverage. We touched on this earlier in the module. Hospice is typically covered by Medicare under the Medicare Hospice Benefit, Medicaid, and other private insurance plans. Hospice care services are provided at little or no cost to the patient. For the Medicare Hospice Benefit, you must be eligible for Medicare Part A. Medicare Part A is also known as hospital insurance. It is part of the Medicare program that primarily covers inpatient hospital care, skilled nursing facility care, hospice, and home health services. The starting age for Medicare Part A is 65. You also must be a U.S. resident. If you're receiving Social Security, you are automatically enrolled. If you are not receiving the Social Security benefit, then you must manually enroll. Medicaid eligibility is going to be a little bit different as it varies state by state. In order to qualify for the Medicaid hospice benefit, you must meet certain eligibility requirements, which typically involves income and asset limits. Private insurance covers a wide range of hospital services similar to Medicare and Medicaid, though the specifics such as copays, coinsurance, and the scope of the coverage services can vary depending on the plan. If the qualification is met through one of the insurance plans, all of the DME or durable medical equipment is covered. This refers to all medical supplies and equipment, such as diapers, wipes, wheelchairs, hospital beds, commodes, canes, oxygen equipment, amongst many others. Along with the DME, there are many services also included with hospice care, such as nursing and home health aid services, social worker services, spiritual and/or chaplain services, and bereavement counseling if needed. It is always best when interviewing different hospice companies to ask what is covered, for how long, how many times a week, and if things progress with the patient, do these timelines change? Choices and revocation. We really want to reiterate that you or the family is in charge of choosing the appropriate hospice care company. The hospital or doctor may have preferred vendors, but it's best to do your own due diligence. If you end up choosing a hospice company that you're not happy with, you're able to transfer to any company that you would like without any ramifications. Medicare, Medicaid, and private insurance will continue to pay no matter what company you are with. If you're looking to stop hospice for any number of reasons, it's quite easy. You just fill out a revocation form and you could pick it up at a later date if needed. Remember, Medicare, Medicaid, private insurance only pay for 6 months of hospice care. We really just want to drive home the fact not to be afraid of changing companies and to make sure it's the appropriate fit for that loved one in need. In summary, hospice care is for terminally ill patients near the end of life who are no longer pursuing curative treatments. The focus is on comfort, dignity, and quality of life without attempting to cure the illness. Hospice is often covered by Medicare, Medicaid, and many private insurance plans, especially for patients meeting the 6-month life expectancy requirement. Families utilizing private insurance should consult the private insurance provider to understand the full details of hospice care coverage under their specific policy. There's no right or wrong time to search for a hospice company. It is up to that individual patient and/or their family. We always suggest doing your own due diligence. Talk to people that have used hospice services in the past. Find out what their experience was with those specific companies. Utilize our checklist that's attached to the module to help interview the different companies. And remember, don't be afraid to change if you're not happy with their service.